Welcome to your total knee replacement. This video is not attempting to be comprehensive, and it may not be accurate. Use it to help your understanding but defer to your doctor for questions. A total knee replacement is a routine surgery that's performed frequently. Nevertheless, this is a major surgery with significant risks. It takes about 1 hour, with some additional time before and after, for preparation and recovery. Most patients receive a spinal anesthetic, similar to an epidural during baby delivery. A spinal may have the least impact on your heart or lungs, but also decreases the risks of infection and improves surgical outcomes. Your anesthesiologist will provide more details on the day of surgery. If you're concerned about being awake, a twilight anesthesia using propofol is often given. A small incision is made in the front of the knee. The kneecap, or patella, is gently moved to the side, allowing access to the knee joint. The worn-out cartilage is removed and the surfaces are prepared for new implants. Although it's called a knee replacement, the surgery is actually more of a resurfacing, where we place metal and plastic implants to cap the bones, allowing for smooth movement again. Like all surgeries, this procedure carries some risks. While the vast majority of patients have excellent outcomes, it's important to be aware of potential complications. Stiffness is one of the more common issues, especially if exercises and stretching routines are not followed. The first 3 to 5 days are the worst. Once you get home, take it easy. Make sure to use compression stockings or an ACE bandage. Also ice, elevate, and work on gentle motion. Try to stay ahead of your pain. Infection is very rare and occurs in about 0.3 to 0.5% of cases. It can be serious and may require further surgery, removal of the knee implant, or even amputation. Best way to decrease risk is to stay healthy, and we recommend protein supplementation for faster healing. Bleeding, blood clots, stroke, and cardiovascular or heart-related events may occur, but are generally rare. Some bleeding on your dressings is common and your home therapist will address it. Implant failure or loosening may occur over time, as well as wear of tendons or ligaments, like the PCL or MCL, potentially requiring revision surgery. There's a risk of injury to blood vessels, which could require vascular surgery. Nerve injury is another risk, and in some cases, this can result in temporary or permanent foot drop, numbness, or changes in sensation. Most patients will experience some numbness, usually about the size of a quarter, on the outside of the knee. This is normal and expected. Some pain, tendinitis, and other localized symptoms are likely to be experienced even with best outcomes. Kneeling on a knee replacement is difficult and often sensitive. Just be aware, especially if your job or activities require kneeling. These risks are rare, but it's important to be aware of them. We'll take precautions to minimize them, but if they do occur, we will do our best to address them. After surgery, most patients go home the same day. Our focus is on getting you moving as soon as possible, typically within a few hours. This early movement helps prevent complications and aids in your recovery. You'll likely use a walker or crutches for the first couple of weeks, then transition to a cane as you regain strength. Most patients shower right away as your dressing should be waterproof. Just be careful to not fall. Physical therapy or exercise is a key to your recovery. It starts at home 2 to 3 times a week right after discharge. As you recover and regain mobility, you'll transition to outpatient therapy or a personal exercise routine. Most patients are able to drive about 2 to 3 weeks after surgery. We recommend trying in a safe environment, like a parking lot, with a family member supervising. We recommend joining a gym for long-term recovery. Access to a stationary bike, which can be used 3 to 5 days a week for 30 minutes or more, and weight training will help strengthen your muscles and improve flexibility. The gym also provides opportunities to resume normal activities. Social support, community integration, and return to a regular routine will help your mental well-being. You may receive opioid pain medication after surgery. Keep in mind, they can be addictive and bear significant risk. So wean off as early as possible. To educate and alleviate concerns, research strategies for pain control and opioid-free recovery. For medication refills, call ahead and only during regular office hours. As for returning to your usual activities, Desk workers return to work around 3 to 4 weeks after surgery, while more physically demanding jobs, such as plumbing or carpentry, may take 2 to 3 months. You can swim at 3 weeks. Golfers can expect to be back on the green at around 4 weeks. Skiing, tennis, and other high-demand sports may take 3 to 4 months, although some patients return even earlier. Everyone's recovery is personal and varies based on individual factors, but motivation and early return to activity are critical to achieving the best outcome. Keep in mind that motion is key. Regular movement will help prevent stiffness and promote faster healing. It really takes a year to reach maximum medical improvement. If you have any further questions or concerns, always feel free to reach out. We're here to support you throughout your journey to recovery, and we look forward to helping you get back to your best self.